Thoracic spine passive physiologicals, we're going to be working on flexion and then extension first of all. For flexion, it's pretty uncommon that you need to push people into flexion because most people tend to slouch, but it may be necessary on the odd patient. To perform this, we're going to go hands over the top of the shoulders in here. You may want to come slightly further back depending upon where you're trying to work within the thoracic spine. And then from there what you're going to do is you're going to initially roll them slightly forwards, and then as they start to roll I'm then going to push down and back. So just watch what happens in the thorax here. So push down and back, and look at that flexion occur in the thoracic spine now. So obviously if I'm performing a grade anywhere, it's going to be in that range, applying the pressure. So we're almost working on that springiness to increase the flexion. Okay, and come back up. So that would be our flexion technique. For extension, if you could just spin around and face the other way. Push right back against the edge of the bed towards me. That's it, perfect. For extension, very similar to the lumbar spine, except what we're going to do this time is we're going to have their arms across their body but also raised up. So if you cross your arms and raise up here. Then we're going to use, we can either use a towel or a pillow or something, depends on the patient really, in terms of bring our arm across them. And just for the sake of the camera, can you just stand up just for me for a second? Stand up for me. Let's just twist that bit around. That's it, jump up. Better. And so what we're going to do is we're going to come across here, holding our, coming round all the way onto the side of the scapula, and then our head's going to come into their neck, and then this hand is going to locate where we want the extension to occur. So very similar, isn't it, to the lumbar spine where we were down here. Now we're in the thoracic spine, so we just come up. We can only really use this technique for mid to lower thoracic though. If we want upper, then you could do that more from a C-spine perspective. Okay, so hands into here, so if I wanted lower thoracic, I bring them into there, and my pressure, I'm going to pull them back from above and push in from underneath. This is very important. Don't let it drag with you, or they'll just come all the way down with you. So have a watch. There we go. So you can see those just start to come into lumbar spine extension, so I can stop, because that means it's the end of his thoracic spine extension movement. If I come higher up, you'll see a lot less motion now. And that's it. Okay. People are often quite surprised by that when they think, oh, it should come a lot further. It doesn't. You're up here, there's not a lot of motion. Okay? Right.